Go ahead.
We have quorum.
Can do a roll call real quick after Walter.
Okay, well, I think we have quorum. I'll just go and call this to order and.
I have not checked. I'm so sorry.
Okay, well, that's all right. Yeah, let's go ahead and go through the roll call. So my name is Dale Woolrich. I'm chairing the PACES committee. Jordana, where did Jordana go? She's our vice chair. There she is. And then Aubriana is kind of our fearless leader that gets us all started. And I'm giving general leadership introductions because I think we have some new people. So all being said, I think I will go ahead and call us to order and we'll start with the roll call. Aubriana.
Thank you, Dr. Woolrich. Heather Berner.
Hi, I'm here.
Thank you. Dale Woolrich. Here. Raymond Proa.
Here.
Jordana Carpenter. Tony Terrazino.
Present online.
Thank you. Mickey Kovach.
Here.
Heather Miller.
Present.
Thank you. Rachel Munn.
Here.
Darren Webb.
Good afternoon, I'm here.
Ann Stafford.
I'm here.
Thank you, Ann. Christopher Gilbert.
I'm here online.
Joshua Ziebler.
Here.
Damon Johnson.
Here.
Brett Poilcom.
Here.
Thank you, guys. Daniel Poteet will be here. Just let me know. Allison Welch.
Present.
Thank you. Lauren Bond. Doug Costel.
Present.
Martin Sammy. I'm so sorry. Samaniego.
Afternoon here.
Thank you. Carla Monjares. I'm here. Thank you. Don Bailey. I'm here. Rex Harmon.
Here.
Thank you. Dale Bradley's next to me. Edward Valinsky. Myself, and then Adam Rodriguez.
Present online.
Thank you. Okay, excellent. We have quorum.
Thank you for that. So I'd like to welcome everybody to our July 10th PACES meeting. We're going to go ahead and get started into our agenda. First, would that be the attachment 3A, and these are our new members to our committee. For those of you at our last PACES meeting, we had edited, reviewed, and added some additional positions to the committee. In the interim, we had an open application process. Application files reviewed and approved by the Bureau, and Aubriana is going to announce those new members.
I will get started first with Damian Johnson. If you could just welcome to the committee and just say hi and let us know your role.
Yes, hi everyone. Damian Johnson. I'm Director of Government Relations with Arizona Hospital and Healthcare Association. So we are participants in the AIM program, and some of our folks used to sit on this committee for that, but unfortunately that grant funding was cut. So I'm stepping into this role. So I serve mainly for the Hospital Association as their point of contact between the legislature and the hospital members. So I'm their registered lobbyist. So happy to be here and provide that policy aspect of it. I also have a background as a paramedic. I was a paramedic for 10 years here in town. So know both sides, and my wife's a pediatrician, actually an ER doctor. So she is very well versed in this too. So I got plenty of resources around me.
Thank you so much, Damian. And we're going to move to Brett Poilcom.
I'm Brett Polican, work for Central Arizona Fire. I'm our EMS captain over there. We recently started our ambulance transportation service, got recognized for the MARC program to the Bureau, and basically represent the Arizona Ambulance Association for the PACES program.
Daniel Poteet could not be here, but she will be here momentarily, just running a little bit behind. Allison Welch.
Hi, I'm Allison Welch. I'm the EMS coordinator for Maricopa Fire and Medical, and we I think my role is the EMS PEC coordinator. So and I'm excited to be here. So
Thank you, Allison. I did get information Lauren Bond is on the call. Is your tech working?
Can you hear me okay?
Yes. Yes, we can.
Okay, great. Hi, I'm Lauren Bond. I am currently the pediatric trauma coordinator at Valleywise Health Medical Center. So I'm excited to be here. There's a lot of focus in our hospital right now on pediatric trauma as we are in our our review year for ACS level 2 pediatric. So thank you.
Thank you, Lauren. And then Doug Costal.
Hi, good afternoon. Doug Costal with Arizona Fire and Medical Authority. I'm the EMS educator. Happy to be here. Thank you.
Thank you, Doug. Martine.
Good afternoon again. My name is Martin Samaniego. I am the EMS program coordinator for Tucson Medical Center, and now I am occupying space 19 for the pre-hospital coordinator.
Thank you, Martine. Carla.
Hi, I'm a captain paramedic with Rio Rico Fire, and I'm on here as a public member, and thank you for having me.
Thank you, Carla. Dawn Bailey.
Hi, good afternoon, everyone. I'm Dawn Bailey. I work as a family consultant for the Children and Youth with Special Health Care Needs program for the Maternal Children's Health Title V work here in Arizona. And I also do other consulting work for other systems and healthcare delivery projects and other emergency preparedness and disaster work for other national organizations. So happy to be here.
Thank you, Dawn. Rex Harbin.
Hi, this is Rex Harmon. I'm the captain paramedic for Gila River EMS. I've been added to the council as a tribal representative, and I am the PEC for Gila River.
Thank you very much, Rex. And that concludes all our new members.
Great. Well, welcome to our new members. We're looking forward to working with everybody as we go forward with our current agenda and future agenda. Next, we have our attendance report, and I'll just have you take a quick look at attachment 3B. As many of you know, and for those that are new to the committee, we will track attendance, and if you miss more than 2 meetings, the Bureau will reach out to you and confirm that you have an ongoing interest and ability to participate in the future. Next, we have our 2025 meeting schedule. In the electronic agenda, you'll see a hyperlink to check on that. That's the schedule for all the Bureau-related meetings, statutory, non-statutory. Our next meeting will be in November 20th, I think. And that steps me to item number 4, which is the Bureau report, attachment 4A.
Hi, everyone. I'm Nicole Witt. I'm the Assistant Director for Preparedness, filling in the absence of our Bureau Chief. That's our first update. We are still recruiting for a Bureau Chief for our Bureau of EMS and Trauma System. And that recruitment will stay open until we fill that position. So if anyone is interested or you know anyone qualified and interested, please let them know to apply. And if they have questions about the position, they can certainly reach out to myself. Happy to talk about it. And I'm going to let Julia do the rest of the updates. They're all part of our service section.
Sure. So we are currently working on developing our operational plans for our strategic plan for this fiscal year. So that's our strategic plan update. I'll skip over EMS for children. That's why we're here today. For naloxone leave behind, we're up to 62 agencies participating, and almost a quarter of our EMCTs statewide have trained. So that's amazing. We're still recruiting agencies to participate. Not sure if you're interested. For the Save Hearts in Arizona Registry and Education program, we are working on transitioning our current hospital reporting platform to align with the National CARES program, and also to simplify the data collection process by moving to REDCap. So if you're part of that process, you will be getting information from us soon. We're also very near to publishing 2024 share reports, which has been a long time coming. So thank you for your patience if you have been waiting for that. Also for the share program with our Premier EMS Agency program, we have new share data quality reports. So we've been doing those over the last couple of months. So again, if you have questions about that, please feel free to reach out to us. I also just want to highlight really quickly our EMS Trauma Awards. We presented these back in May at the STAB and EMS Council meetings. Those winners are currently listed on our website. And then lastly, for the trauma registry, just an update, we're not quite ready for the Q1 data submission, so Carissa will reach out with updates on that. And that is all that I have to share.
Great. Thank you for those reports. We now have discussion and action items. First of is our PACES meeting minutes from the March 20th meeting. I'll refer you to attachment 5A for that. I'd like a motion and a second to discuss those, or to be able to review first and discuss. So
Motion to discuss and review.
And who was second? Anybody?
I thought I heard someone on the call.
Oh, I second.
Great, thank you, Chris. So having a first and a second, take a minute to refer to the attachment. Give you a minute to look them over. Or any committee members or non-committee members that have amendments that they'd like to propose? Hearing none, I would ask for a motion and a second to be able to vote on our meeting minutes for March 20th. Thank you, Ray.
A second.
Thank you, Chris. Okay, so we're going to go ahead and move to a vote. Those who vote to approve the meeting minutes for March 20th, say aye.
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 Thank you. To not approve, say nay. Hearing none, do we have any abstentions? Hearing none, the meeting minutes for March 20th are approved. Our next discussion item will be to review the training module that was jointly assembled with PACES and the Education Committee on children with youth and special healthcare needs for EMS providers. Excuse me, that's attachment 5B. Chris, would you be willing to discuss this one with us?
Yeah, so the Education Committee and PACES convene in 4 different work groups from January through June to collaborate on the development of a training tool that will focus on children and youth with special healthcare needs. The sessions are dedicated to structuring content involving specialty care considerations for children and youth with special needs in slide format, ensuring that the material was comprehensive and practical. So they really worked on kind of shortening up and going through the information. The joint workforce finalized and reviewed the content on June 3rd to present for discussion and vote today in the Education Committee. We actually did not move to approve or amend it. It was a motion was moved to create a work group to review the scope of practice. So they were more concerned that while there was a lot of great information throughout the presentation, that it was outside the scope of practice for EMTs and paramedics in the field. So the special work group will be formed and convened to review that scope of practice to see if we can make it more applicable information to practicing EMTs and paramedics.
Thank you, Chris, for that update. I wanted to just give some, a shout out for the work group that helped put this together. I think it's a very expertly done, well put together training module, and look forward to that ongoing review regarding scope of practice. Irrespective, I think it's a great educational tool. How it's applied down the road, I guess, will be yet to be determined.
I agree with you, Dr. Orwood. One of the things that we discussed is in one of the work groups is, while it may not be applicable to scope of practice, at times there are things that are extremely unfamiliar. And while like ventilator management and central lines, the parents in those situations, because something has to be done, are usually well versed. I think it's great education just for EMTs, paramedics to see a central line, to see a trach, and because you may only come across 1 or 2 in your career, let alone regularly. So to see some training on it, I think introducing the familiarity is good. So I think with the training, after going through it, we'll still kind of discuss being able to keep it there so it introduces education, even if it is kind of outside the scope of practice.
Great. Thank you, Chris. Okay, well, moving forward, next item would be to discuss the 2025 pediatric drowning and submersion injuries in Arizona. That's attachment 5C. Brianna and Antonio.
Yes. Is Antonio on the line? Antonio Hernandez?
Yes. Can you hear me?
Yes, we can. Thank you, Antonio.
Thank you. And so just a reminder, my name is Deacon Antonio Hernandez. I'm with the Arizona Department of Health Services Community Integration Officer, helping connect with resources, partners, and programs, collaborations throughout. And in this case, just helping to bring together the best kind of real-time information or picture we can get of the situation regarding children and adult water incidents. And so the Children's Safety Zone is a collaboration with local fire departments, hospitals, and media to come together to pull near real-time statistics. And here is a feature of the Valley of the Sun, which includes Maricopa County and Pinal County statistics. There are a few other entries, one within Coconino, but that dates back to an adult water incident in October. And there are two in Gila County that are not part of this as well, but just want to give you kind of a picture, and not only of the snapshot to date, but then comparison to last year at this time. And what you are viewing is a chart that has the total drowning deaths for 2025. And again, this is just the best data we have in this time frame, looking at the largest contributor of data, which is Maricopa County, Pinal County, Valley of the Sun, and that is 15 in comparison to last year, which was 22 drownings. And we can then further delineate that data into 2 pediatric drownings recorded for 2025 so far from the contributions of these local fire departments, and then 13 adult drownings with 44 water-related incidents occurring. And then as it compares to last year, the 2 pediatric drownings this year versus 9 last year, and then 13 adult drownings this year remains the same as 13 drownings last year. And of the water-related incidents, we had 44 this year to date, and then 51 last year. So we did kind of pull an alarm of like the abnormal rates of pediatric drownings last year, and then the group wanted to recap and visit this again to see where we're at this year. So that's what this slide represents. It also has the hyperlink to the Children's Safety Zone, and seeing if we could possibly get more partners and counties into that, contributing to that.
Thank you, Antonio.
Antonio, if I could ask you a question. On this table here, I mean, row 2 is all of 2024, but 2025 is only the 6 months?
Yes, the date so far. Yeah, so it'll keep going to the end of the year.
Okay, so extrapolating those overall incidents, we're dramatically higher this year than last. Am I interpreting that right?
If we finish off the year with more incidents kind of at the rate, then yes, we could.
Oh, goodness. Okay.
So I actually had the same question when I read that. It was a little bit confusing. So based on these numbers, it might be helpful just to put your, for the 2024, that it's January to December, and then specifying 2025, because I think the heading's a little bit confusing, but that is a really sizable increase.
Yes.
Incidents.
Yes, great. So this is 2024 comparison to the total year, and then here is a 6-month snapshot to date, January to June of 2025.
Can I interrupt, please? This is Lori Stoffer from Scottsdale Fire Department and the Drowning Prevention Coalition. I want to just clarify that it actually is January through June of 2025, those numbers. And I've put it in the chat what we're looking at, because Ed Swift does a really amazing job with Children's Safety Zone of tracking them. So you have year to June and those numbers even from the last 3 years. So we're actually sitting very well for 2025. I just wanted to clarify that Antonio is correct, but it's not January through December for 2024.
Oh,
if you want to look at the information that I put in the year to date, that was what Ed Swift released on Wednesday. So I put that in the chat so you can compare the last 3 years.
So just a clarifying question on that one. So this is almost a side-by-side comparison, 6 months to 6 month?
Yes.
All right, thank you.
Okay, let's vote. little more reassuring.
Well, I also had the same question. That's why I asked Antonio to speak on it, because EMS for Children was presented with similar data, and I wanted to bring this to the committee to discuss on ways that we can, prepare better for this, have our agencies be more prepared, and our hospitals, if there's any prevention efforts that we can start prioritizing for the next year ahead. So, thank you.
Any other comments from the group? Committee or non-committee members? Okay, Antonio, thank you so much for presenting that.
You're welcome. Thank you.
So moving to our next discussion item, this discussion includes voting to approve forming a work group. And that's in regards to reviewing the Arizona Department of Education guidelines, Red Book flow charts. So in that, for that purpose, I'd like a motion and a second to be able to initiate a discussion on that Red Book. Motion and a second. Great, thank you.
And Mickey research as well.
I didn't catch the
Second.
And Mickey. Okay, thank you for that. Abriana, or do we have Ashley?
Yes, Ashley is present here from the Department of Education.
My name is Ashley Bello. I'm the School Nursing Services and Health Coordinator at Arizona Department of Education. Thank you for having me here today. This is a collaborative project between ADE, ADHS, and some of our district lead nurses throughout the state. It's ready to go out to schools, but we wanted to discuss kind of reviewing those flow charts to make sure that it is appropriate when to call 911. This chart is, or this project is actually a resource for unlicensed personnel that work in the health office when a nurse is not available to them.
Thank you, Ashley. And just to add on to that, EMS for Children and PACES were included in the development of the original document. So at our last PACES meeting, it was requested to have this be a discussion item and possibly formulate some work groups. I'm anticipating 4 to go over 10 flowcharts each time. And then that way ADE can disseminate it out following that for the next 3 years with no revisions.
Having been part of this over 15 years ago, I can attest to the fact that I think it's a great resource. And as we were scrolling through it, you saw that whole table of contents. These are pages that are applied to each individual scenario, whether it be an allergic reaction or, different medical events that could occur at schools. Having reviewed that, does anyone have any amendments or proposals or suggestions in the review process?
I think the motion is to form a work group to review this. So it would be kind of forming a work group to go through this on a more page by page basis. Yes.
Oh, okay. I was getting feedback on the process of the review, but understood. Okay, so all being said, the motion is to vote to create the work group. Thank you, Dr. Bradley. Can I have a motion and a second to form a work group to review the Red Book?
Motion.
Also watch seconds.
All right. Okay, so hearing that, a vote to form a work group to review the Red Book. Those who are for forming the work group, say aye.
Aye.
Anyone opposed? Anyone opposed, say nay. Hearing none. Any in an abstention? Okay, the ayes have it, and we'll be forming a work group. Brianna, would you like to do a hand count now, or would you like people to email you?
Can you just email me first?
Okay. So if you'd like to participate in this work group in the review, thank you for letting us participate again. Go ahead and email Abriana, and you can see that our email is in the agenda.
Right there.
Okay. All right, next issue is to discuss, amend, and approve work groups and work group topics. And this is for proposing future work groups, but those who are in their last committee meeting, we did discuss forming potentially a work group on child maltreatment and creating an educational module in relations to that. That was one that was on the table. Anyone else in the room have any other suggestions for potential work groups and projects down the road?
I would just like to say I support forming the maltreatment work group. I know that's something that's been presented to EMS for Children throughout the year. That's all I have for comment.
All right, well, let's go ahead and move, step towards a motion and a second to vote on whether or not we're going to form a work group for child maltreatment educational module. I have a motion and a second.
Motion.
I second.
Okay, great. Okay, those who are approve forming a work group module for child maltreatment, say aye.
Aye.
That's a quick clarification before the vote. I apologize. So typically all the educational modules have gone kind of jointly with education just to try to make sure that it's, if the focus is for EMS, that it's kind of EMS guided education, just so that way. So I just want to make sure from a process perspective, unfortunately, this was not on the agenda for education, and education doesn't meet again until November. So certainly that could be an action item for that committee, but just wanted to see historically to try to make sure we don't have the education modules going back and forth to any committee meetings.
Actually, so would it be better stated that we vote to bring to education the proposal of creating the child maltreatment work module
That
for
would be
their next meeting?
my recommended friendly amendment, if someone would like to make that amendment, yes.
Okay, having heard that, thank you, Dr. Bradley. The motion at this point would be to bring that proposal to the Education Committee at their November meeting to assemble a work group on child maltreatment going forward, and that work group would be done jointly with education. Okay. So having heard that, I'd like to go ahead and go to a vote. Those who approve to take that proposal to education, say aye.
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 Anyone opposed, say nay. None, any in abstention? Okay, thank you. The ayes have it. We will be proposing and adding to the Education Committee's agenda in November the formation of a joint work group between PACES and education on child maltreatment educational module. Okay, thank you. So next on our agenda is the to step down to updates and resources. And this is where we have a committee roundtable update. And that's where we have individuals who are either committee members or non-committee members share pediatric emergency medical trauma, injury prevention, behavioral health, and our family-centered updates related to their the activities they're doing in their own positions and their positions that are held with the committee. This is again a roundtable discussion. We do this as a standing agenda item for PACES. I'll open it to the room and those on the call. Any activities that people want to present?
I can start, and then I'll have Georgiana follow me after. So for EMS for Children and PACES, I think it's relevant to announce what agencies were recognized at our last meeting. So we're proud to highlight these agencies for their work in pediatrics and all of the quality improvement that they're doing. So those agencies that were recognized were Arizona Fire and Medical Authority, Central Arizona Fire and Medical Authority, Gila River Emergency Medical Services, Lifeline Ambulances Services, Maricopa Fire and Medical Department, as well as Porco Valley Fire District. So thank you again, PACES, for all of your hard work reviewing those applications and supporting this initiative. Very grateful for that.
I don't have really anything to share. Our numbers in the ER have kind of diminished for respiratory season, and so we're kind of seeing more of the heat related stuff. But other than that, nothing really to report.
Anybody else in the room with
I would just like to go through the roster and just ask on everyone. Thank you. This is a time for us to share whether it's you've been exposed to certain pediatric cases, have any questions from your community, just to let us know so that we can have an open discussion and dialogue about it. So Heather Berner, can you provide us an update at this time?
So I am the director of a nonprofit here. It's in Arizona and the national nonprofit. So as far as any trends that we're seeing in this past 6 months, 6 to 9 months, the nonprofit I run is for Safe Haven. And so it's the prevention of infant abandonment. And we actually did see a cluster increase of infant abandonment in Houston, Texas. So there is actually abandonments all over the country. But there was a 2-month period where I think 6 babies were abandoned in that Houston area. And so I think that we're doing some data research and communication with other agencies regarding the possible influx with immigration crisis that we're facing. Thank you.
Thank you, Heather. Dr. Woolridge?
I think I can have something maybe to say here. One of my jobs in Tucson is I medically direct the Children's Advocacy Center, Southern Arizona Children's Advocacy Center in Tucson. And an active effort that we're currently going through right now is trying to streamline our process for primarily adolescent patients who are with concerns for trafficking. Those individuals identified as potential runaways or with drug or alcohol related events or sexual assault are brought to one of our behavioral health clinics down in Tucson and CRC. So when they do get enrolled into the CRC, it's typically a 24-hour hold. So what we're trying to do is expand our ability to do outreach to those individuals, to offer them medical care regarding potential assault when they have their medical clearance related events. So we are trying to streamline that, and that's something that's been one of our more active efforts as of yet. So the Advocacy Center very often is a referral-based center. So when schools are not in session, we see our volume go down a little bit, but the concern for trafficking has not seemed to follow that same annual trend. So that's a pretty active effort that we're working on right now in Tucson.
Raymond Proa?
Yes, my name is Ray Pro. I'm the EMS captain with Williams Fire Department. We've been having actually just for pediatric calls, a lot of pediatric seizures, most of them febrile, along with altitude sickness, which is pretty normal in the summertime. We get a lot of people from, down at west side of Arizona, California, come up to 7,000 feet. And so headaches, nausea, vomiting, and if it gets more serious. So we are seeing definitely an uptick of those. Currently rolling out our new Hantevi app. Also, we're a beta group for some of the trainings, new alerting and training in the app that's built in. So you can do continuing education with all the crews that gets out alerts for protocol changes and things like that. And just finished up our AHA training center, and our NE training center will be finished this next week. So busy.
And we already spoke with Jordana. Thank you. You have another one?
So sorry.
No problem.
So I'm not political, but just with all the changes that are happening, a lot of our kids with special needs are having issues with following up providers. So we might see an influx of kids coming to the ERs and using those services, just so everybody's kind of aware to kind of keep that in mind, that things are changing very significantly for these families. So just want to put that in there. That's all.
That's a good point.
Thank you. Tony Carazino?
Hello, everybody. Tony Curazino, Chief Flight Paramedic for Gardenier and the NAMES representative. I apologize for not pulling some of the statistics, but it seems anecdotally that we've had an increase in pediatric trauma with UTVs over the last couple of months with summertime, but I don't have statistics to really pull to see if it's an increase in the trend or if it's just our seasonal norm. That's really all that I have.
Chris, I see your hand raised.
Yeah, I just want to echo Tony's sentiment there that here in Southern Arizona, we've been running on PEDS traumas in UTVs, unhelmeted, unrestrained, and it is an uptick for our base specifically. We've seen just an influx. We flew 4 this week, and all of last summer we flew 7 total. So it's a big increase here in Southern Arizona as well, and it's mainly these side-by-sides, not motorcycles or four-wheelers. It's been side-by-sides, families just tossing kids in unrestrained, unhelmeted, and losing control of their side-by-side.
Chris, that's been the same for us as well, where it's minor, 2 minors and 1 UTV side by side having an accident and, driving straight into a tree.
I wonder if it would be beneficial for the committee to start spreading out information about Quail Kids. It is a program hosted within the Bureau of EMS and Trauma that goes out to schools and educates with Fish and Game on safe practices for riding in these off-highway vehicles. So I'll share that with the committee after, and we can spread the word. That would be greatly appreciated.
That would be awesome. Thank you, Brianna.
Thank you. Mickey Kovach.
Well, we have a Safety Town. Banner has a Safety Town that goes all over the state and presents injury prevention and also drowning and a whole bunch of other things. They did like 24 schools last year, so they're pretty busy. We did see in my pediatric deaths last year, I had an increase in pediatric deaths, and I saw a lot more special needs kids who were coming in with codes. Drownings we saw were down. We have a decrease this year in our pediatric drownings, but we do have an increase in our adult side of the drownings. And behavioral health numbers, we always get an increase in behavioral health pediatric patients in August and April. So the beginning of school and the end of school.
I hope our speaker today can touch upon a resource that they have for that. Thank you. Heather Miller.
Can you hear me?
We can.
Yes, we can hear you.
Oh, sorry. I couldn't tell if you could hear me because it mute twice. In Kingman, we're in the same boat kind of down in Tucson. We've had a lot more trauma, but ours is not only just side by sides and the UTVs. We have a lot of like horseback riding out here, more towards the western part of the state. So we're getting a lot of pediatric patients falling off our horses to head traumas. And then and then we do have a couple special needs children that we do see. The other thing we recently had was a pediatric patient that came in with anaphylaxis from a scorpion sting. So that was a pretty significant reaction our area and our providers hadn't seen in a long time. So that's kind of what we're dealing with out here.
Thank you, Heather. Rachel Munn. I'm going to come back to
Yeah, sorry, it took me a second to find my unmute button. Thank you for the opportunity. I don't have anything incredibly significant to update the committee on from the SAMES area at this time, though. Thank you.
Thank you, Dr. Munn. Darren Webb.
I think we're seeing about the same thing that the more side-by-sides for us teenage age kids, more than the younger kids. We've had some pretty good ones in the last couple months.
Thank you, Darren. Ann Stafford. And I'm going to come back to you, Joshua Ziebler.
Sorry, it just took me a second to unmute. Devin is present and is going to give our update.
Thank you, Ann.
Just from the PPEC side of things, we've added a few new facilities this year. We've added a total of 7. One of them is a critical access facility. We've had 2 of their scheduled site visits so far. The rest of them are upcoming. Other than that, we're hoping to put out some more education this year for our member hospitals and the employees there. And then we have our annual nurse trainings coming up. We have CPEN, ENQC next week, and our CEN course in October. Those are our updates.
Awesome. Thank you so much, Devin. And Christopher Gilbert, just to make sure you have nothing else to discuss at this time.
Nothing else to discuss at this time.
Thank you. Joshua Ziegler?
I have nothing to report.
Thank you. Damian Johnson?
Yeah, I'll take a stab at this. My first time here. I guess I can get a little political just because it's my job, but I think that what took place at the federal level is something that we're monitoring on a pretty tight basis, trying to understand what that's going to look like. We've been talking to some CFOs out there as well, various different hospitals that they're going to have to start making cuts next year, if not sooner. As they plan. I know that it is delayed until 2028, but as many of you know, we all the departments as well as hospitals start financially planning at least a year out, if not longer. So there is some concern about cutting of services, increasing OB deserts, but as well as since over 60% of the kids in Arizona are born on access, that cut there in funding is going to be problematic and unclear what other types of cuts they're going to make as far as services and what the impact is going to be to EMS as well. That is something I've had a conversation with the Fire Districts Association about. In particular, some of the areas that the majority of their payers are Medicaid. So it's a hard time right now, and we're unclear of what it's going to look like exactly, but we'll keep moving forward.
Antonio, you have your hand up?
Yes, just kind of add to that regarding the 2025 Kids Count Data Book was released by Children's Action Alliance, which also places that vulnerability of uninsured children, with Arizona children being ranked number 2 in the nation for uninsured. So just wanted to add that to the conversation. Thank you.
Thank you, Antonio. Is there any additional discussion around that, or I'm going to move to Brett?
No, and possibly just the food bank. You know, the highest peak happens at this time for food insecurity with children, and 1 in 5 are facing that, and this is kind of like a peak season for that among pediatric populations. That is all.
Thank you, Antonio. With that, I'm going to move to Brett.
Yeah, so being new, kind of take a stab at it, but historically, around this time of year, we have a unique population in Prescott, Arizona, if you would. We have a very geriatric-based population. I think our average age is like 67 years old, but we still have a very growing young population within the surrounding communities. With that being said, that young population often runs into vehicles when school starts, and it's often an uninformed driver, unaware driver, impatient driver, those early morning things. So I think we're going to see that in the next 2 or 3 weeks when school starts back up in our world. So around that August 1st time, I think it's actually July 31st when our kiddos start back in, which is unbelievable. But every year we tend to see about 2 or 3 fatalities, unfortunately, when those school buses start to roam around. So as an awareness level on our end, and just kind of inform our public. So.
Good. Thank you. Danielle Poteet.
So I'm Danielle Poteet. I'm the PEC for Summit Healthcare up in Charlotte, Arizona. And we're seeing a lot of the same things: ATVs, equestrian events, traumas. Respiratory has finally taken a fall. And then up in that area, we have, of course, increased population of everybody trying to escape the heat and come up. So we have a lot of increased congestion, which I think adds fuel to the fire, and then the fire dangers that we're in up there as well. We're in stage 2 restrictions up there for quite a while.
Surrounding fire, do we have evacuation plans for families that they can use to have considerations for their kiddos or children? We'll find out. Allison Welch.
I don't have anything to report at this time.
No worries. Thank you. Lauren Bond.
Hi. Recently at our center, I'd say in the past 6 months, I've had 4 cases of accidental firearm injuries for pediatric patients that are 6 years old or younger, including 1 death. So that's something we're going to look further into. Traditionally, I've seen the trigger locks and things that we're giving out in emergency departments or pediatric clinics. I've also participated in Banner's Safety Town through the Injury Prevention Alliance of Phoenix. So just looking to explore other options for firearm safety in our area, specifically as an urban center. And that's all I have at this time.
Thank you, Lauren. Does anyone have any resources that they can provide for firearm safety or want to discuss further?
Well, kids would be another part of that, no?
I don't believe so.
No.
Maybe. Okay. Thank you.
I know historically NRA has provided numerous trainings and even materials to help inspire and educate. Is that for firepower programs kind of in our region?
Okay, Doug Costa.
Yeah, the cost with APMA. Just to report, a couple months ago, we finished our pediatric assessment. We use hand-heavy. It's working well with the crew-based assessment that we've been doing. We've teamed up with PCH on trauma training and PHI recently with Chris Gilbert as well. So that's pretty good scenarios that some of our members got a chance to display some pediatric care. And with everybody else, I have seen an uptick with traumas and behaviorals in the last month. So that's it.
Thank you, Doug. Marty? I don't know if I said a lot of Martine, are you on the call?
Yes, ma'am, I am. I don't have anything at this time. Thank you.
Thank you. All right, Carla?
So I don't have anything to report as far as any reports that I pulled, but the only thing I can talk about is some of the outreach efforts that we do here at Eureka Fire. So some of the things we do are we do CPR classes, but we also give away car seats, and we have car seat technicians, and we do quite a bit of those. We also give away bike helmets through the Rotary and Banner. And we do public education through the schools as well. And last thing would be we do a safety day every year in October, and it pulls quite a bit of kids. And that's all I have.
Thank you, Carla, for that update. I would just like to add on to that. For our EMS agencies or hospitals, are we doing a lot of car seat safety initiatives? And during that time, are we able to provide some epic car seat stickers so that those can go out with the families?
I know they do lots of car seat at the hospital. Okay. She does a lot of car seat. I have some of the epic cars.
Okay.
So awesome. I did take them over to pediatrics once. They handed them out.
Thank you. Yeah. Thank you.
You get some more of those. Nice.
All right. Excellent. Thank you. Dawn Bailey.
Hello. Just a couple updates from the Children, Youth with Special Health Care Needs area. Our Title V program has wrapped up most of our needs assessment community process and is pulling together the findings for to help drive our priorities for the next 5 years. Specific to the Children, Youth with Special Health Care Needs program, there's a lot of areas of gaps within the systems of care. Just to add on to the discussion, we anticipate that those gaps will increase given some of the potential cuts and impacts coming down the pipeline. The other area of really intense focus that we're highlighting is around adequate health care for children, youth with special health care needs individuals that are aging out of the pediatric system into the adult system. We find that a lot of our adult hospital systems are not necessarily equipped or prepared to address the complex health needs of some of our population. But we also know that, our pediatric hospital, specifically Phoenix Children's, is really at capacity and drawing a line of not admitting over 18 unless there's a specific exception. So I think there's an opportunity with this group to continue to engage in that work because obviously transport would potentially be affected and also just helping on that education of care and pre-hospital care. So a lot of work in those areas coming. Thank you.
Thank you, Dawn. That is something EMS for Children has been made aware of, as well as these children that do turn 18 often don't get the same services once they turn that age. So I think it would be good for us in future discussions to really consider that and see how we can make these hospitals that aren't Phoenix Children's be a little bit more prepared for that unique population. Thank you, Don. And then Rex Harmon.
I didn't come prepared with any numbers or anything, but one of the significant things we're working on is we have a pretty robust QA program. And that's one of the things I met with our medical director on this week, is trying to bring that more in line, looking at the mark information out there and kind of look at what we can be tracking better as far as our pediatrics.
Thank you, Rex. From an EMS perspective, what are you prioritizing for tracking for pediatrics?
Right now, in general, it's just kind of looking at the care, make sure the care is appropriate. We're not particularly tracking, trauma versus medical versus behavioral. I'll say right now, that's probably our biggest. Behavioral is probably our number one area that we see a lot.
Okay. Thank you, Rex. That sounds like a common theme in the room today is behavioral, maybe something that we should be discussing a little bit more for the future. Thank you, Rex. I appreciate that. Dr. Bradley, you said you're going to put it in the chat?
Yes, so in the chat, I did include the resources for the data for Quail Kids, as well as the link to resources for that. So I did see Heather Miller. I believe he said you're also doing some Quail Kids outreach in your area. But for anyone who's not heard of the program and doesn't know the data, those links are in the chat if you're interested in looking at that. And just another interesting pediatric kind of side note, the Central Region went live with adding a pediatric calculator to their guidelines for EMS. So I think that's a pretty big step for EMS providers embedded in their guidelines. There's going to be a pediatric calculator for them to use. So just from another pediatric safety perspective.
Thank you, Dr. Bradley. It's really cool. I know I already went, but I did just want to make everyone aware that the EMS for Children program is launching the National Pediatric Readiness Project Assessment. This goes to all EDs, freestanding or not, and it's launching March 2026. One of the big efforts, as we know, is protecting EMS for children, and so trying to get our PACES members and individuals that are on the call to be engaged with this survey. It not only helps our program to understand how we can serve you, but also helps your hospital to have quality improvement initiatives that you can continually access throughout the years or the 5-year span cycle. So I just wanted to make everyone aware of that, as well as we have pediatric education advocacy kits that just got released. So there's one relating to multi-system trauma, and I'm happy to share that with anyone if you just want to email me. And that is all I have to report for EMS for Children. And then Adam Rodriguez, do you have anything?
No, sorry, I was having trouble finding my mute. No, well, I guess I do have perhaps something. Is there any awareness of any I guess like a recognition week or month for heat related injuries with respect to pediatrics? Is anybody aware of that? I should be privy to it, but as I'm hearing these updates, that it occurs to me to ask. And if not, I suppose I just a thought that if there was enough interest around that topic, that maybe we could talk about that. I see Dawn's hands up.
Yeah, Dawn?
Yeah, I do see July is Extreme Heat Awareness Month, but it's not necessarily specific for kids only. It's really related for all vulnerable populations. So elderly, children, and those with chronic illnesses.
Okay. Yeah, that's about what I'm asking for. Thanks, Dawn.
Yeah.
Nothing else. Thanks, Aubriana.
Good. I think the general themes are behavioral health, UTV incidents at this time, and I really think it's interesting with that pediatric calculator as well as the infant abandonment as well. So thank you.
Thank you for leading us through that. I find it interesting to see what everybody's doing, particularly noting the fact that you guys are so actively involved in supporting your communities in the positions that you have. So thank you for sharing that. And we'll keep this as a standing item on our agendas going forward. As far as additional updates, do we have Keith Francis to talk about the Arizona Complete Healthcare System? That's attachment 6B.
Keith, are you available?
I am here.
Thank you. If you want to share the screen or if you want me to. Okay.
You have the stage.
Awesome. Thank you so much for allowing me to be here. Hello, everyone. My name is Keith Francis, and I am a first responder liaison for Arizona Complete Health. I'm going to give you guys a brief summary of our crisis system overview, very micro snippet. As you guys see in this first slide, nope, you go ahead, you're right. I'm going with you. As you guys can see in this first slide, it's going to be a crisis system structure. You guys can see at the top is access, and right underneath that, we have the respective health plans. And on the left-hand side, you can see a red arrow pointing down to Arizona Complete Health, and we are the regional behavioral health agreement holder. Basically, that just means that we coordinate and manage behavioral health services in our designated region. If you go further down to with the red arrow, it shows you the crisis services that we're going to provide to the community. If you can go to the next slide, please.
Yep.
Awesome. Here is a representation of the areas in which we cover. As you guys can see, there is the state map of Arizona. Inside of that, I'm not sure if you're able to see that, there's different little markings and indicators to show you which health plan is in what area. We oversee 12 of the 15 counties currently, all except for the central region of Maricopa, Gila, and Pinal. Everything surrounding that, Arizona Complete Health Plan is in those footprints. As of October 1st of 2022, Arizona has moved to a single line provider for our entire state. So Solari, in which we contract, they oversee the crisis line, and that number is 844-534-4673, also called the statewide crisis line, also known as the Hope Line. What's cool about this line is wherever you are in the state of Arizona, if you give this line a call, we'll be able to help you with crisis situations. And I'll explain a little bit more about what I mean by that if we go to the next slide, please. And so here is our mission statement. I'll read it to you guys briefly. I know it looks like a lot, but it's easily explained. And so it reads, to facilitate the improvement of crisis system processes and programs among system partners, to include law enforcement and fire and EMS departments, 911 operation centers, emergency departments, and crisis service providers, and to provide education to those same system partners regarding the crisis system, mental health first aid, resiliency, crisis intervention team, international. And the purpose is to increase first responder confidence in and usage of crisis system and health plan alternatives to detention and emergency departments. I know that was a mouthful, but it can be easily summed up as we want to collaborate and walk side by side with whatever processes and programs you guys have and see what we can do as the REBA to help bolster that and add to the resources that are already within the community. And the purpose in that is if we can educate our first responders and how to utilize crisis services, we can deter them from arresting some of these folks that's dealing with mental health issues and thus impeding their growth and getting the necessary services that they need, counseling, management, all those kind of things that it could potentially miss if they're being detained. Same thing if we're having EMS and fire folks take those folks to the emergency departments. They're going to be taking up beds that are for medical use and instead of for psychiatric or mental health, behavioral health issues. If you can you go to the next slide? Thank you. And so I know that at the top of the crisis system structure, it said access. And I want to be very clear that everyone is eligible for crisis services regardless of their insurance status. So that means if they have access or they do not have access, as long as they're within the state of Arizona, if they call this number, we are going to help them. We define a crisis as whatever this individual is going through that they cannot cope with. So that can be anything from suicidal ideation without a plan, to depression, anxiety, schizophrenia, the whole gambit. Whatever they're dealing with, we're going to go out and help them with that crisis. We have a no wrong door approach, meaning that we have 24 hours a day, 7 days a week crisis line. So we have someone on the phone, professionals on the phone that they are able to speak with at all times of the day. We also have our crisis mobile teams. These are folks that are dressed in plain clothes. They are in a plain car. They do not have the lights and sirens, and they will come out to help de-escalate and get you guys resources for whatever it is, the situation that they're dealing with. This is cool because our crisis mobile teams, they go out to hospitals, jails, your home, Jack in the Box, wherever you feel comfortable to meet them, they're going to come out to you and, like I said, help de-escalate, assess, and get those members resources. And then we also have our crisis stabilization units. These are also called 24-hour observation units, and they're strategically placed throughout the state in what we call hotspots, so that we can make sure that we're servicing the community to the best of our capability, and that the community has access to these facilities, as well as our mobile teams being able to assist in getting folks to those facilities if they need any psychiatric stabilization or med stabilization. We also have, like I said, along with our no wrong door, crisis services are never refused. So whatever it is that that individual is going through, we're going to come out and help you guys in the best of our capabilities. We believe in intervening in the community because we know there's a lot of individuals that want to stay in the community for whatever reasons, you know, work, family. I've even heard of pets. Some people didn't want to go to get psychiatric help because they wanted to take care of their dog. Who's going to take care of their dog? So we try to stabilize within the community before we do anything as far as sending them outside of the community. What's also cool about the services that we offer is we have real-time escalation. I know I'm telling you guys that we have a no wrong door approach, and you're like, can't be. If you hear the word no, we can escalate that in real time. So let's say, for example, at 2 o'clock in the morning, if there's an issue at 2 o'clock in the morning, you can escalate that in real time. Can you please go to the next slide, please? Thank you. And again, so our crisis system goals are designed for early intervention, and we want to try to get in there and help as early as we can. But whenever that person is dealing with a crisis, you can call any time with that. But if you notice early signs, you can call earlier rather than later. We strive to reduce unnecessary detentions and use of hospital emergency departments and involuntary psychiatric commitments. Like I said earlier, we want to reduce these because it's maladaptive to the patient and the care, right? So if they're in jail or if they're in detention or if they're in the hospital, they're not being seen for their mental health, behavioral health needs. So we want to reduce that with our crisis line folks. We want to reduce the revolving door usage of 911 and emergency services. We know that right now, everyone is short-staffed, right? That is no different for our law enforcement partners and our first responders, right? And when people are in crisis, they have a tendency to call 911 because they don't know what else to do. So instead, we've got this alternative to calling the statewide crisis line. If they call this number, we want to reduce the strain that we put on the 911 system. We want to do this by using crisis services like the crisis line that I'm telling you guys about, our crisis mobile team, and our stabilization units. Again, we have a no wrong door, and it doesn't matter what insurance they have or don't have. They are going to be seen and helped in those services. We want to increase our communication and collaboration between first responders and crisis service providers, outpatient and inpatient providers, emergency departments, and crisis or system partners, county attorneys, and everyone that is included in that process. We do this by doing a crisis protocol, which we revise every year. It's just a basic guideline of what services look like, what that format should follow, what it looked like, and if you have any questions, it gives you where to go, numbers to dial, and even has the verbiage and definitions in that as well, because we love our acronyms in this field, right? And then we also have crisis system meetings that we do quarterly, where we share this data that we collect from the crisis line with you guys. After all, it is your data, and we want to be as transparent with that as possible, because I know it's really cool that when you guys are looking for grant opportunities, you need data to back that up, and we can provide that. And we have a great data analytics team that can get that to you in a variety of ways and make it digestible for whomever you want to present that to. We have crisis cards and flyers that we can send out with the numbers on that, so that you guys can pass it out to members, parents, so that they can call for their kids instead of you're calling for them. And we just have a lot of different trainings that we offer so that we can make sure that you guys understand how to utilize this crisis system. Can you go to the next slide, please? And so here is a look at that little red in the beginning, that box that we had circled. This is that blown up, just showing you the providers that we have in the area. And so like I told you, we oversee 12 of the 15 counties, and these are the services in which you would find in those counties. Again, I know I'm going through this really fast. I'm short on time. And if you want to know more about this, if you go to the next slide, please. There is my information along with my other first responder liaisons. You can see which areas that they operate in, and you have their email address and their phone number. I just want to thank you guys for your time and open it up for any questions. I know I went fast. I apologize. I only had 8 minutes.
Thank you, Keith. Any questions from the group for Keith?
One question. Is there an age range that you prefer?
No, we see everyone. So typically for about 5 years old up until the geriatric age, we see everyone anywhere they are, as long as they're within the state of Arizona. And again, they'll go to schools as well, wherever it is that you're calling from.
Okay. Thank you.
No problem. And again, my information is the one that's circled. If you guys have any questions, I know we went through this really fast. If you have any questions, feel free to email me or give me a call or a text, and we can set up some time where I can go over this a little bit more in depth with you guys.
Keith, thank you so much for that update.
No, thank you.
Okay. All right, thank you for that. So our next update would be Jessica to talk about the ADHS high-risk perinatal program.
Yes, hi, I'm here. Thanks, Dr. Woolridge. That's perfect, thank you. Hello, everyone. My name is Jess Payne, and I'm the high-risk perinatal program manager for the Arizona Department of Health Services. I've been asked to give you all a very quick overview of HRPP, or a micro snippet, as Keith put it. I liked that. And then we can open up for questions at the end as well. Okay, so today I'll cover our program mission, statistics, components, and more specifically our consultation and transport component. Thank you. The mission of the high-risk perinatal program is to reduce maternal and infant mortality and morbidity through a regionalized statewide system of coordinated care that includes consultation, transport, hospital care, and community health nursing follow-up. And also, that's my daughter in the photo. I include her in my slide. She was admitted to the NICU in 2018, and now she's 7 years old and thriving and beautiful and the light of my life. So I have to include her. I've got personal experience in this field as well. So next slide. Thank you. So our philosophy. The HRPP philosophy states that recipients of the HRPP services are families who live within broader systems that include extended family, friends, and communities. All service providers by this program are reflective of this philosophy and encompass these values. partnership with families, members of the medical community, so all of you, funding sources and policymakers, risk appropriate care for all, regardless of geographic location and ability to pay. So that's a big one for our program. And then family-centered and developmentally appropriate care. And again, mitigation of catastrophic costs associated with newborn intensive care, which we know are extensive. So next slide. You can scroll down to the next one. I've got a graph.
I'm frozen.
Oh, shoot. Okay. Do you want me to present?
Go ahead.
Okay. Let me see. I'll pull up my slides. Too much information today. Even our computers are like, okay, listen, this is a lot. Okay.
I can grab if you want.
Okay. Can you see this?
Yes. Thank you.
Okay. So let me go over here. Okay, so where was I? So this is the graph that shows our infant mortality rates in Arizona and the US per 1,000 live births from 1960 to 2021. And I'm working on getting more recent data, by the way. But HRPP was established in 1972. So you can see how Arizona's infant mortality rate was much higher in 1960. And it began to drop to meet the statistics of the US in the 1970s. So this is a good indication of how effective HRPP is to Arizona. And we're actually the only state in the US that offers a program like this. So we're very, very proud of our program. And then this is our, I call it our component tree. So we start with transport services, which consists of both maternal and neonatal consultation on the state line, as well as medical transport services, and that's both air and ground. And then HRPP also provides hospital services, which include enrollment of infants who qualify for the program, inpatient physician reimbursement services, and then that financial assistance to families that I mentioned earlier. Then enrolled infants may participate in community health nursing services, where they'll receive at least 4 home visits a year from a registered nurse with a background in neonatal intensive care. So we're also very proud of our nurses. Our CHNs, community health nurses, offer extensive resources and education to families who are caring for high-risk infants. Okay, let's see.
Hey, Jess.
Yeah.
Can you just put it in presenter view and enlarge the screen a little bit? Little. Thank you.
Is this good?
There you go. Thank you.
And my daughter is coming in the room right as I'm presenting. Can you wait? Or just sit quietly right there. Okay, summer break. We're almost there. Okay. So the HRPP consultation line is a 24/7 toll-free line that's listed there at the top of the screen. This line connects any healthcare provider in the state to a maternal fetal medicine specialist or a neonatologist to receive a consultation for the patient within their care. So if it's a mom or a baby. If the MFM or neonatologist deem that transport is necessary, they will facilitate either an air or ground transport to a facility with the appropriate level of care for that patient. So all perinatal care center levels are determined by the ADHS and the Arizona Perinatal Trust. So we collaborate a lot with them. Okay. And then this is our HRPP hospital and transport map. This map showcases all HRPP contracted hospitals and transport bases. And this is for the MFMs and neonatologists who are providing consultation to determine which transport company has the capability to transport the patient of any given case, right? And then to which hospital. So the MFM or NEO will secure a provider at the receiving hospital they've selected to transport to. And that decision is ultimately up to them. But I also want to note here that physicians are contractually obligated to transport HRPP patients to the closest, most appropriate level of care, regardless of whether the receiving hospital is within the doctor's medical group or not. And additionally, the transport company that executes the transport should be the company that has a base closest to the patient in nautical miles, if going by air, and that company must also be contracted with HRPP. So I place a lot of emphasis on closest, most appropriate level of care for both hospitals and transport bases. And to that, all HRPP contracted air and ground transport companies are required to have specialized high-risk maternal and high-risk neonatal teams who provide emergency transports to high-risk mothers and newborns despite their ability to pay. It's an amazing program. And also HRPP pays for a portion of the emergent and non-emergent transports or back transports, despite the patient's insurance status as well. It's really, really amazing what we do. Okay, and this is a list of our current HRPP transport companies, both ground and air. Some representatives are on this call. Thank you for what you do. And then this is our current list of contracted hospitals. There are many across the state, and we continue to grow. A lot of hospitals. And then these are our contracted community health nursing agencies and all of the counties that they serve. And then this is our contact info. So again, I am Jess or Jessica Payne. I'm the HRPP manager. And then Donna is our claims coordinator. She handles all inpatient and transport claims. And then Itzel Celaya Resendez is our home visiting program manager. And then Cindy Walker is our developmental specialist. She's a contractor that works within the NICUs to provide developmental education for the nurses who work within the units. And she's only been a nurse for 42 years, so not very long. But she is wonderful, and we love Cindy. Okay, was I faster than 8 minutes?
Great job.
Thank you. Any questions for me?
Any questions for Jess?
I just have a quick question. How do hospitals and EMS agencies get registered to be part of this program?
Email me anytime, and we'll meet and talk about it and set up a contract. Oh, and
So
I can put my email.
Jess, is it fair to say that most of the neonatal transport are hospital-based systems, or are these independent agencies through the fire districts?
Hospital-based, mostly.
Hospital-based.
Yes, but I mean, it's statewide. We're all over. And that map, I can actually put that link in the chat too, to show you our contracted hospitals and then our maternal and neonatal air bases. Let's see, I have the link here. As well as my email. Yeah, there you go.
All right, any other questions for Jess? Jessica, thank you for that presentation.
Thank you.
Appreciate your time.
No problem. Thanks.
Okay. So I think that brings us towards the end of our agenda. We have items to be considered for the next meeting. I personally am a big fan of work groups. I think I plugged it earlier. We did vote to approve one work group that we're going to take to the Education Committee. But for other ideas about projects that we can have going forward, this would be the time to suggest them or to email Aubriana. Any other items for discussion for our next meeting, November 20th?
I do think it would be advantageous for us to come up with an idea of how to be prepared for behavioral health pediatric emergencies. If that's something we can all collaborate on and send me topic ideas, I think that would be a great next step.
Okay. Any other suggestions? Okay, hearing no others, we have now our call to the public. Any comments or announcements that people would like to make? Okay, hearing none. Look a little bit further down on your agenda. We have upcoming events. So a fair amount of events in July, August, September, October. I'm not going to read them all to you, but all of them look very interesting. They do have hyperlinks where you can link and see what they're all about. Do visit the Bureau's email or website for news and training programs related to CE and other upcoming events. Our next meeting will be November 20th, and I'm looking forward to see you all there. Again, welcome to our new members. Appreciate your participation. Look forward to working with you guys. All being said, I will now adjourn the meeting. I'd love to use the gavel. Adjourn.
Thank you.
Thank you.
Thank you.